Zirconia crowns are a popular choice for restoring anterior front teeth due to their combination of durability and aesthetics. They are made from zirconium, a very hard and strong material that can withstand the forces of biting and chewing.
Here's some information about using zirconia crowns for anterior teeth. Checkmark aesthetics. Zirconia crowns have a translucent color that mimics the natural look of tooth enamel.
This makes them a great choice for anterior teeth, which are more visible when you talk or smile. To further enhance the aesthetic results, the dentist or dental technician can customize the shade of the zirconia crown to match the color of the adjacent natural teeth. Check mark strength and durability. Zirconia is one of the hardest dental materials available.
It's resistant to cracking and chipping, which makes zirconia crowns a durable option that can last for many years with proper care.
Checkmark biocompatibility. Zirconia is considered to be biocompatible, which means it's unlikely to cause an adverse reaction when placed in the mouth. This makes it a safe option for most patients. Checkmark preparation. Zirconia crowns require less tooth preparation compared to some other types of crowns. This means that more of the natural tooth structure can be preserved when placing a zirconia crown. Overall, zirconia crowns can be an excellent choice for anterior teeth due to their natural-looking appearance and long-lasting durability.
As with any dental restoration, it's important to discuss the options with a dental professional to determine the best solution for each individual case.